Pregnancy and medicines. Introduction. The decision about whether or not to take a medicine while you are pregnant depends on the risks and benefits. Select true or false. Correct. The benefits of a medicine are the good things it can do for the mother and her baby. Risks are the ways a medicine might harm the health of the mother or her baby. One section of the drug facts label is for pregnant women. Select true or false. Correct. Labels on OTC drugs have information that can help you decide whether or not to use the medicine while you are pregnant. All OTC medicines have a drug facts label. Should a pregnant woman take any regular vitamins that she took before she was pregnant? Select yes or no. Correct. Women who are pregnant should not take regular vitamins. Ask your healthcare provider about prenatal vitamins that can help keep you and your baby healthy. Should you stop taking all medicines before you get pregnant? Select yes or no. Correct. Not using medicine that you need may be more harmful to you and your baby than using the medicine. Check with your healthcare provider to decide which medicines you need during pregnancy. Thank you for using Explain.